Typically what happens is during a pregnancy, the volume of the breast grows. And then after pregnancy and with kind of the withdrawal of hormones, there's some shrinking down or what's called postpartum involution or reduction in the volume of the actual breast. And that may or may not lead to a little bit or a lot of drooping. Some patients will get bigger and really never reduce in size and therefore are too big. And so the typical kinds of things that we'll deal with breasts will be a volume that the patient doesn't want, either too small or too big, and then a shape that a patient doesn't like, which would involve drooping. And so we can apply a combination of procedures, which would be an augment or a lift or a reduction, to help patient regain the shape and size that they want to be. So if the volume is too small, we add an implant in order to make it whatever volume we want. Sometimes we'll use fat if we just need to get a little bit of extra volume. If a patient has an appropriate amount of volume but is droopy, then we'll do a lift, which means reshaping the breast but keeping the same volume involved so that it appears higher up in a better shape. And if someone's too big and droopy, we'll do what's called a reduction. A reduction is the same thing as a lift, except we also remove some tissue to make the breast overall smaller. And then the last one that we didn't mention is someone who's too small and droopy, which is one of our most common breast procedures, which would be an augment lift. So we'll put in an implant to adjust to the volume that we want, and then we'll do a lift to build the breast around that implant, lifting it up into place.